Site, and I'm going to talk about HealthKind. And Rhonda Parmley is the executive director, and she very much wanted to be here, but she's teaching a class right now, so she should be here just in time for speed dating. So I'll fill in. I've just seen the slides a few minutes ago, so I probably won't follow them too closely. But HealthKind, I'll talk a little bit about the history and the vision. Southern Sudan is the world's newest country. It was just formed in July of last year, after many years of very violent civil war and conflict, and the conflict is still going on there. And so there are quite a few Sudanese refugee communities here in the United States, and HealthKind was kind of hatched when Rhonda Parmley, the director, met with Queer Attempt, one of the refugees in the Denver community. And Queer had come here and has gone to nursing school and has had a dream of going back to her home village in Jonglei and starting a health clinic for women and children. And right now there is nothing, there is no health care whatsoever for this population. In fact, in most of the country, there's very little infrastructure to speak of in the country as well. So it's been a real challenge, and most of the families have been really torn apart by violence and are spread all over the world. And so now that the country is formed and hopefully things will settle down, they have a vision of going back and building infrastructure and community services that we've all grown used to. So anyway, HealthKind, the first project is intended to be a health clinic for women and children there. We're really in startup phase right now. I'm a board member. I'm just helping advise them on getting things started, but we're just on the verge of applying for the 501c3 with Linda's help. I've worked with her on a couple of nonprofits before, so that'll be a big milestone that will allow us to go seek some grant funding and work with foundations and that. Up until now, the funding has all come from the Sudanese refugee communities all over the country. So one of our board members is a Sudanese refugee and the co-founder as well. And they've been traveling around to the different communities and holding, basically dinners, and people come and donate money, write checks, and been incredibly generous. So we're very grateful for that. Ron and Queer are going to Jonglei Village in May, first trip to Sudan, and Queer has very good connections with the local governments, and that's we're hoping to have some agreements formed and find a site for the clinic. And I think one of the visions is this will be a sustainable operation. So the idea is not just to drop in, raise money, drop in, and build something, but to get the community involved, train people, and have the community actually own it and run it once it's up and running. And then hopefully it'll work, and we will be able to replicate the model in other places in Sudan and other places. I think it's pretty self-explanatory. Obviously, when Rhonda gets here, she's can tell you a lot more about the vision for HealthKind and that. But we're a member of the Greenhouse Project that Andrew's going to talk about here. And I think one of the things we found is being a startup, being able to collaborate and talk to other organizations that are doing similar things, and have many of them been doing it for years, has been a huge benefit. So we're actually going to have an office down and be one of the tenants in the Greenhouse Project down in Denver. And right now, the organization around is based in Fort Collins, and the other members, the founders, are based in Denver. So we're kind of split. Anyway, if you have any more questions, feel free to ask me, but Ron does the expert. When she gets here, she'll be happy to talk to you about it.
Thank you, Mark.